No,
Yeah.
upcoming event. That's what it says.
Now it should be live, sir.
Yeah, it is.
You're able to see.
No, it's on the screen. Live on custom live streaming service.
Can somebody just check the YouTube, sir? Because I can't check from here.
No, I'm on it, but it says upcoming event, and time given is 18:55.
Yeah, but I have started the live stream. Kindly check again, sir. We're live for the last 20 seconds.
Yes, come on.
Okay.
It is working. You are all online.
Thank you, sir. Thank you very much. I needed
Very
that.
good.
Much needed that confirmation.
Yeah.
Where is my friend?
No.
Well, it's not yet coming.
Who is this AFVOA?
Oh, that's a mystery, sir.
Identify Kralo.
It is slightly lagging behind. Then you are live.
There is a lag.
Colonel Shashikant has come.
Yeah.
Marshal Vartman.
Well, Sashikant, can you kindly switch on your video, please?
Yeah.
Give me 2
Okay.
minutes, sir.
Yeah.
Give me 2 minutes. 2 minutes. I have to keep checking the YouTube.
Yeah. I request the ladies and gentlemen to mute, please.
Yeah, we are live now. Well, ladies and gentlemen, may I kindly request you all to kindly mute yourself, except Marshal Vartman and our guest speaker. Sashikant, can you please switch on your video, please? We're not able to see you.
He's logging in.
Yeah.
There he is.
There
Yeah.
he is. Sashikant, can you see us? General Raghavan, sir, good evening.
Good evening, sir.
Good evening.
Good evening.
Hi, lovely to be.
I think he's having a problem with connecting, Colonel Shashikant.
Number has increased to 30 now.
Sashikant is not there now.
I think he's re-logging in.
Good evening, sir.
Sukho, good evening.
Good evening, sir.
General Jose also is logged in.
Hi, good evening.
Sir. Good evening, sir.
Good evening.
Hi, Harsha.
Where is Shashikant is re-logging, I think.
Good evening. Radha, welcome. I think you joined the meeting. You muted yourself, so I can't hear you.
Well, Sashikant, we can't see you on the screen.
I think you need to give him a call, I think.
No, he has logged out. He was having a problem logging in, so he's logged out. He must be reconnecting.
Sir, till he logs in, please tell us something about AFVOA.
Who's asking that?
Jairaj, sir.
Colonel Jairaj, sir.
Please log into our website. We got a superb website, www.afvoa.in, and it'll give you the history right from 1996, I think, when we were formed. It's probably one of our
1994.
one of the very good websites you will see. So much I could have definitely told you of AFVOA, but I don't want to because we want to trumpet our website. So just go through that. It's an excellent one.
August 1994 is the day.
94.
Any progress on that committee which was formed for amending the rules and also?
I think it's going on. Tomorrow, day after is the last day, the 28th of February. So we should know. Colonel Bhupinder is the in charge. So he will let us know on the 28th.
Okay, sir.
Now there is Shashikant.
I am on a WhatsApp Zoom.
He's not picking my call also.
There. Yeah, yes, come on.
Is there, sir?
Okay, Shashi. Yeah, I can see you. Right. Can you please unmute Shashi? There you are. Okay.
Am I audible, sir?
Yeah, you're audible.
Sir.
Good evening, ladies and gentlemen. Welcome to the second ECHS meeting that we have organized from the Armed Forces Veteran Officers Association of Chennai. Welcome, Colonel Shashikant Tumma. Nice to see a handsome, smart young officer, well turned out and
Thank you, sir.
good.
Thank you, sir.
Thank you very much for agreeing to speak to us today. The ECHS for us retired guys is very is the key to our happiness and good health and let me say low stress. So there are a lot of people who will have a lot of questions and clarifications. We have sent them already to you. We will go by it one by one. I request all the participants to wait for your turn to ask the question, and it will be moderated by the Secretary Wing Commander Harshavardhan. Please remember, he is the regional director of Chennai. And you must remember that the questions that you ask him must be within his purview. So he can look after Chennai alone. And if there are something beyond that, it's for him to take it up with Delhi, with his MD. So welcome, Shashikant. I hand you over to Wing Commander Harshavardhan, who will
sir. Sir. Thank you, sir.
Thank you.
Good evening, ladies and gentlemen. It is my pleasure to welcome you all for this evening's talk show on the ECHS. And a special welcome to our guest, Colonel Shashikant Tumma. Welcome to this evening's talk show, Shashikant. We look forward to a very informative evening. And ladies and gentlemen, before I hand over the show to Colonel Shashikant, I think it's good for all of us to know a little bit. I wish to introduce him to all of us for you to know as to what is his background. Colonel Shashikant Tumma was born on 22nd August 1978 at Hyderabad. He underwent his schooling in Hyderabad from Takshashila Public School and Ratna Junior College. Having completed his initial professional training at the National Defence Academy, Kadakwasla, 96th course, and Indian Military Academy, 106th course, Dehradun, he was commissioned into the Regiment of Artillery into the 137 Medium Regiment on 13th May 2000. He has a vast operational experience especially in mountain and high altitude warfare. He commanded his parent unit at Palampur from June 2017 to June 2018 under 39 Mountain Division, and then in the Batalic sector on the line of control under 8 Mountain Div, Headquarter 14 Corps from July 2018 to June 2020. He had a 3-year command. On relinquishment of his command, he assumed the duties of Director, Regional Center, ECHS on 11th August 2020. He has attended many courses, some of them being the Young Officers Course Field Artillery from the School of Artillery, Devlali, Signal Officers Degree Engineering course from the Military College of Telecommunication Engineering, Mau, Advanced Data Processing SAP course from Military College of Telecommunication Engineering, Mau, Junior Command course from Army Warfare College, Advanced Gunnery from School of Artillery, Frequency and Spectrum Management course from Signal School, Cochin, Senior Command course from Army War College, Mau. He has been an instructor Class A and company commander at Officers Training Academy, Gaya from December 2012 to December 2014. Like I said earlier, his command appointment was Commanding Officer 137 Medium Regiment. The officer has been awarded with the GOCNC Eastern Command Commendation Card in 2006 and GOCNC Art Track Commendation Card in 2015. Officer is married to Mrs. Lalita Tumma, who is a yoga instructor, and they have 2 children, Divyanshi, age 9 years, and Lokit, 6 years. The family recently joined the officer in December 2020 here in Chennai. Well, ladies and gentlemen, that is a very short introduction about Colonel Sashikant. Well, Colonel Sashikant, we will start the show now, and you can. I will do the share screening, and whenever you say, I will, start showing the slides. And once you're finished with your introduction or whatever you want to say about the latest things, then we start with the question and answer session. I hope that's fine with you.
So that's fine, sir. Absolutely fine, sir.
Right.
So thank you very much for the introduction, sir. Sir, at the onset, sir, I'd like to thank all the veterans who are present here on this video conferencing, sir. In fact, I think this is a very good idea and a very healthy interaction which one can have. Basically, this holds me in good stead to get acquainted with the problems or any kind of grievances which the veterans have. So it gives me a first-hand information, also gives me the opportunity to address them in a much more faster method rather than relying on the WhatsApp or email or the normal correspondence which we have, sir. So I thank you all for this opportunity, for giving me this opportunity, and also do recommend that in future we should be having such kind of interaction. So whatever the issues are there pertaining to ECHS, then I can raise those issues or try to mitigate these issues. So for the betterment for the overall in the organization interest for especially veterans as pertains to the ECHS. In the next 10 to 15 minutes, sir, I will not dwell much upon the ECHS. I'll just give the basic updates as to what has been the the latest which has come from the ECHS. And then lastly, once we finish with that, sir, then we'll have the queries or clarifications which you have, sir. So that's the preview, sir, the updates first, and then the question answers which we have, sir.
But sir, are you able to see the share screen? Sashikant, can you see the share screening?
Yes, I can, sir. I can see it, sir. Yes,
okay,
I can see it, sir. Yeah. So we can have the next slide, sir. So this is the preview, sir. Firstly, some updates, and basically then that will be followed with the questions and clarifications. I'll try to keep myself as short as possible so that we can dwell more on the question answer session, sir. Next, sir. Sir, recently there's been a change in the helm of leadership at the Central Org, sir. Major General Naveen Indurkar is the new, he's the managing director who's joined in on 14th of Jan. He's assumed the appointment, sir. And erstwhile General Prasad, he's posted out. He's moved as the General Officer Commanding for the K&K sub-area. So there's been a change at the helm of affairs at Delhi. So this is the first latest update which I wanted to bring out for all the veterans for their information. Second is regarding the funds, sir. It is generally said that the fund crunch, pardon the date which is given, sir, it is 26 Feb 21 actually, sir. So generally this year, as part of the revised estimate, there has been no deduction or no cutting of the funds which has been allotted to RC Chennai. So whatever 23.24 crores has been allotted, that stays. In fact, the demand is that if at all 1 to 2 crores more is required, that can be made available to the RC. But as of now, we are comfortable, and I will be able to take on the reimbursement bills as well as the hospital payments in the next 1 year, in the next 1 month, for the payments to the hospitals and reimbursement bills of individuals which are there, sir. So there is no problem in terms of the fund allocation. Overall, ECHS around 500 crores has been allotted. So that has been distributed to all the RCs pan India. The demand for RC, I have sent it, but that is yet to be allotted. As of now, we are, as I said, we are comfortable. So there is no fund crunch per se for payments part. Next, sir. Next, I come to the empanelment status, sir. As on date, under Regional Center Chennai, sir, I have got 30 hospitals under me. So this is the breakdown which is on your screen, sir. So if you see, out of 10, predominantly 11 are the ones which are eye hospitals, which include Shankar Netralaya, Dr. Agarwal Eye Hospital. 13 are multi-speciality hospital. But these multi-speciality hospitals are not the so-called branded ones, which is to our preference, like Apollo or Fortis or what the veterans desire, sir. And moreover, with the COVID, these 13 hospitals, sir, have been hit by the availability of doctors, wherein most of their wards have been shut because of the COVID. Either the health staff or the doctors have got affected. So most of them are giving selective service. Now, selective service, when I say, is firstly, in the most prominent of the list is a global hospital, which is only offering 4 services despite being empaneled. The others were giving selective service, but as of now, with the unlock which is in vogue, so they have, the normalcy is being restored. So they are coming in a very graduated manner back to offering full services. Stop referral is there with only one hospital, sir, that is of the Medway Hospital, which still the management has to take a call. As I said, the COVID actually hit all the hospitals so bad that actually the resumption of services has become a problem. Dental hospital as on date, so that is the only sore point in the empanel status, that I do not have any dental hospital per se. And the only reason being for this is that it is economically unviable for the dental hospital to take on the CGHS rates for giving service to the veterans. That is the sole reason. For example, starting from the consultancy to carrying out the dentures or the RTC, the rates are very, very less. And that is why there's been the dental hospitals in Chennai are not very forthcoming. We are still in talks with 1 or 2 of them, which are saying that the management has yet to take a decision. As I said, the COVID also had affected them, wherein they had shut shop. Now they are opening, they have resumed, but still we're in talks with 1 or 2 hospitals are there which were in talks. If all is well, then this should come on board for the empanelment. Cancer and cardiac, ENT, and knee hospital is there on the, as shown on the view file. We don't have any issues on that. So total 30 is what we have, sir. So this is looking after the entire, all the 15 polyclinics, the referrals which we have, the empanel hospitals which we have, sir. Can I have the next slide, sir, please, sir? So these 30 hospitals, sir, if I have to break down, if you see, Chennai has got 18, and then it is adequately distributed amongst Vellore, Krishnagiri, Tirumalai, Puducherry, Kumbakonam, and Tanjavur. So this is just the distribution part of these 30 hospitals, which was earlier reflected, sir. May I have the next slide, sir, please, sir? So just coming on to the updates, sir. First update is regarding the individual medicine reimbursement claims. So that is in vogue till 28th of February. There have been no orders received as yet regarding the extension of the same. So till 28th of February, you can the next 6, that for month of March and April also you buy it, but bill has to be before 28th of February. Then only that will be preferred. Any extension on the same should be conveyed, but as I said, as on date, there is no update on the same. Coming to the COVID vaccination. COVID vaccination is a big candid and frank, sir. As of now, as on the communication with today with the ECHS, the central law, it will be strictly as per the COVID app.
Shashikant?
The web page or the app which has been launched by the government of India. So veterans would have.
Shashikant, can you hear me?
We lost him. His signal quality is bad, sir. That's why.
Yeah, I think he should put off his video. If he puts off his video, it might be okay. He can manage it.
I think missed out what he spoke last 3-4 minutes.
And the most important part, actually.
Yeah, correct.
I'll ask him to repeat it again, sir. On the
he should run through this slide, and he should keep his video off. He'll be able to manage the bandwidth.
He's coming online.
I can see, okay. He's trying to speak.
So,
Shashi, you're muted.
Samuel, sir?
Okay, there you are.
I request all our veterans to kindly switch off the video. It may help in a better streaming.
Sir.
Shashikant, we can't see you. Are you back online?
Yeah, I can see him.
He switched off the video, sir. He switched off the video. He is on.
Am I audible, sir?
You're audible.
Yeah.
You can...
Keep your video off.
Sir, am I audible?
You are audible, Shashikant. We can hear you. We can hear you, Shashikant.
It may help if he switches off his video.
Sir, am I audible?
Yes, you are audible. Can you hear me?
Harsha, show thumbs up.
Sir, am I audible, sir?
You are audible and you are visible also.
Sir.
Okay.
Sir, I will just repeat those points. I think it got left out because of the...
Let me go back to the share screen at the last. Okay, go ahead.
Your internet is unstable बोल रहा है.
Yes, Jessica. Yeah. Vatta said he's got a connectivity issue. I've asked him to come log in on his mobile and go to a place where there is a better signal.
Yeah, okay, fair enough.
Yeah, Harsh, this is Karan Shanmugam. In the meantime, when he comes online, can you show the front position slide which you were showing in the beginning?
I will share it tomorrow morning, sir. After the meeting is over, I will share it with you personally, not to worry.
Okay. Thank you, Harsh.
Slide kami.
Asha, did you tell him to keep his video off?
No, sir. But since he's going out,
because he's not able to do it. You can see him.
You can see him.
Yeah, he's there on the screen.
Oh, I'm on speaker view, so I'm not able to see him. Yeah, he's coming, sir.
Sir, am I audible?
You're audible, no problem. You carry on. I will share the slides whenever you want me. Just and for a better signal strength,
So
if you want, you can put off your video so that you have.
Right, I'll do that, sir. Right.
I'll do the share screen now for your slides. There you are.
Sir. Right, sir. So I'll just, sir, I firstly apologize for the network issue, sir. I'll just go through the updates once again. Please bear with me. Regrets for the same, sir. So the individual medicine reimbursement claims, that is invoked till 28th of February 2021. Now there's further extension there is no orders for further extension on the same. We are awaiting the same, but no orders as on date. So till 28th of February, you can purchase your medicines even for the months of March and April, but the bill has to be before 28th of Feb 2021, sir. So that is one. Second, coming to the COVID vaccination, sir. Now the COVID vaccination, the orders are still ambiguous, sir. My communication today with the central org, they have directed that as on date, it is strictly by the COVID app. So all the ECHS beneficiaries and veterans who are affected will have to register themselves on the COVID app, and thereafter the modalities as to how the vaccination would be conducted, that would be disseminated. As of now, the COVID app can be downloaded from the Google Play Store, but the registration process per se has not yet started. This has been confirmed through the helpline number of the COVID app also. So we are awaiting further orders of the same. As of now, above 60 years and those above 45 with comorbidity are eligible for the vaccination. Now the modalities, whether it has to be done on payment, whether it will be done at the polyclinics in conjunction with the military hospital or in a civil institution, those orders are still ambiguous, sir. We are awaiting for the same. In a day or two, the same should be cleared. Regarding the polyclinics, sir, as of now, the orders are that only the registration assistance, that is the help in terms of registration of the veterans, that can be undertaken. So any veteran who requires, basically the JCOs who was retired, who require any kind of assistance in registering themselves on the COVID app, that process for the polyclinic will be able to undertake. So once the clear instructions are availed, sir, once I receive the same, then that will be promulgated to all the polyclinics and also through the various media apps, social media apps. So the same will be clear, sir. The PC staff, sir, as of now, just an update that all the polyclinic staff, including the regional center, being the healthcare workers, they have been vaccinated. The next point is the 64 KB online system. So from 1st of January 2020, now the entire polyclinic modules and the system has come onto online system, which is outsourced by UTI. So the thing is that starting from the polyclinic OIC to the doctor to the pharmacy, all these modules are all centrally connected to a server which is of source.com. The erstwhile manual referrals or manual issue, at times there are grievances which come from the ECHS beneficiaries saying that the referral is not issued. So this system requires that your smart card be swiped at the reception, and thereafter you are then directed to a medical officer, whether you have to be given medicines from the pharmacy or a referral, that all will be generated online. May I have the next slide, sir?
1 minute.
Sir, may I have the next slide, sir?
Yeah, wait. I'm just doing it.
Sir.
Yeah.
Now connected to yes, I can, sir. Now, sir, connected to this is the 64 KB card, sir. Now the orders in vogue are from 2018, April 2018, the 64 KB card is mandatory. So all ECHS beneficiaries who have the 32 KB card, they are requested to please update it onto the 64 KB card. The application is available online, and accordingly one can access it, and the relevant details can be entered to update the same. Any kind of assistance which is required in terms of filling of the same, so the RC, the regional center, can be contacted, and accordingly we'll give you the necessary help. 16 KB card is obsolete. So with that, one will not be able to avail the services of the ECHS. The contact list and checklist, now that has been updated and has been given for circulation to the various polyclinics. The same is also available on the ECHS website. The checklist which I'm referring to is that which pertains to the individual reimbursement claims. Now, of late, sir, there are many observations or grievances from the ECHS beneficiaries saying that whenever the claim is uploaded, there are some observations given by the bill processing agency in terms of some documents being deficient or some images or x-rays not being uploaded. So as a consolidation of all the observations which have been raised till date, these checklists have been made and have been promulgated to the various polyclinics. It is there up on their notice board. The soft copy is also available. I'll be forwarding the same to the secretary of the AFVOA, sir. Coming to the Miyot Hospital, sir. Now, this is a very, this is one of the grievance which I get. The Miyot Hospital erstwhile used to be empaneled with ECHS. Yes, sir. Miyot Hospital was empaneled with us. In November 2019, they did not renew the MOA with the ECHS. So as on date, sir, the hospital is not disempaneled. It is not renewed the MOA. The reason being that there was an outstanding amount of approximately 11 crores, which was on date. The latest on this issue is, sir, that the entire amount, the balance amount as on date is around 39 lakhs, which is left payment to the Miyot Hospital. Out of that, another 12 to 15 lakhs would be paid this week. So the overall amount comes to around 22 lakhs. So we have had a meeting with their chief financial officer and also the vice president of the Miyot Hospital, the liaison cell. So they have assured that they would take up this point with their management in their next board meeting. So we are hopeful that yes, that the services might resume with Miyot, but we are still awaiting a call from their management. Whatever pending bills are there, there is nothing pending from the regional center side. It is only the balance amount which is left. It is basically for actions from the Miyot Hospital, wherein they have to upload certain claims, certain documents, certain bills. Once that is uploaded from the hospital side and the necessary waivers are taken, the entire amount also would be paid to them. We are hopeful that Miyot Hospital would consider it favorably and they would come in for the empanelment, but a decision is being awaited from their management. Coming to the ECHS smart cards, sir. Now the ECHS smart card distribution erstwhile used to be done by the station headquarters, but now it has been disseminated to the polyclinics. So on receipt of your OTP with the relevant documents which are given in the SMS, you are taking those documents, the ECHS beneficiaries can report to the polyclinics, and once the documents are verified, they can accordingly collect their smart cards. Bills and claims processing. So this is a issue which is ongoing, which is a routine. Now, erstwhile, before the individual reimbursement bills were not in vogue, the workload was under control. But presently, with the huge and voluminous claims coming off, specifically of the medical reimbursement, the work has been increased with the regional center also. We are working over extra hours also to regularize the same. So that is the target which you had, and subsequently reduce it to 15 to 15. That is provided that there are no observation rates either by the BPA or by my medical office. Starting from 1st of March next month, whenever there is an emergency admission of a ECHS beneficiary, whether it is in an empaneled hospital or in a non-empaneled hospital, the emergency information report or the emergency certificate which the hospital will be issuing has to be routed to the regional center for vetting by the director. So this is the order which has just come day before yesterday. This has been promulgated to all the polyclinics, and accordingly, as part of the documentary requirement, this has been included. So this is just for the info of all the ECHS beneficiaries. There is a provision of a high-powered committee for revision of claims. Now, when I say revision of claims, this ECHS beneficiary, say for a particular treatment, has shelled out some certain amount. It may be a high value amount, but when the bill is processed and the amount is approved, it is as per the CGHS rates and it is quite less. Now, if the ECHS beneficiary feels that his claim is justifiable and he is entitled, or he can give the justification that he should get more than the CGHS rates, then there is a provision in the ECHS wherein your claim to the polyclinic can be routed to central log, which sits in the Ministry of Defense. It is basically chaired by personnel of the Department of Ex-Servicemen Welfare, wherein the claim is again reviewed, and accordingly, if it is a genuine case, then the same may be sanctioned. Then the amount more than the ECHS can be remitted, that can be approved. So this is one provision which one must explore if in case ECHS beneficiary. Now coming to the role of military hospital. So earlier when the COVID was on, the military hospital did not take any cases, but as on date, so the military hospital has been directed. There will be no denial of services to any ex-serviceman by the military hospital, be it for ortho, dental, that the military hospital will be able to take on. So there are, as of now, there are no cases, but these are the orders for the that they will take on the ex-serviceman load, also any kind of treatment that would be taken on. Next coming is to the Sehat OPD app. Now Sehat OPD app is basically a teleconsultation app which is to be started by the end of Feb. Now this is basically a consultation app wherein the ECHS beneficiary sitting at home can directly contact his doctor, and accordingly the consultation can take place, and then issue of medicines can take place for the consultation. Now there's for certain issues which are still yet to be cleared as to how the medicines would be used. May I have this slide, sir?
Sashikant, if I might interrupt, that last point, we didn't get it clearly. There was an audio disturbance. Can you tell about the last point once again?
So may I have the next slide?
Did you hear me? Can you repeat the last point once again? We lost your audio.
Yes, sir. So the government of India.
What the series connection is lost.
Sir, am I audible, sir?
We lost you in between, Sashikant. Okay, I'll move on to the next slide. We'll come back to this later. Next slide is on.
Right, so on this here app, which the white card holds up the address. So, right, so I'll just come on to the last point, Sehat OPD consultation app, sir. Now, this is a app which is launched by the Ministry of Defense under the government of Sir, am I audible, sir?
Yes, you're audible. You're audible.
Yes, sir.
Continue.
Sir, I will just dwell upon the last line, sir.
Okay.
So the Sehat OPD app. So this is an app which has been launched by the government of India. This is basically to enable the ECHS beneficiaries or a veteran to consult his doctor directly for any kind of consultation for medicine or any ailment which he is having. This is basically keeping in view the COVID protocol. So this is to restrict the movement. So based upon this, there is a certain registration which is to take place. Now this app has been launched, but again, sir, there are certain issues which are to be ironed out on this. So once the module is launched, the ECHS beneficiaries also can use this app to teleconsult with their doctors directly at the polyclinic. This was the point, sir. So the next one, sir, is regarding white card holders. Now, the PWD Act, sir, this is of 2016. There has been a revision in the personnel with disabilities. So it may so happen a few cases have come to light wherein a erstwhile white card holder who was a 32 kb holder, when had applied for a 64 kb card, had got a normal card. So this is basically, sir, that the PWD disability which was reflected in this 32 kb card may not be in sync with the new PWD Act of 2016. The case has been taken up with the central law. In case there is any issue of a white card holder who feels strongly that he requires a white card holder, the case can be routed to the regional center for issue of a white card in the 64 kb format. The next point, sir, is regarding the FMA. This is the fixed medical allowance. So the fixed medical allowance, ECHS beneficiary should not be in receipt of the same if he is availing the services of ECHS. Now, this is almost this is an amount of rupees 1,000 which is given at the time of retirement. One has to forfeit this to avail the ECHS facilities. There is a special clause which has been introduced for this FMA. It is that in case a ECHS beneficiary belongs to a district wherein there is no polyclinic, he has got the option of opting for an FMA, that is fixed medical allowance, wherein he'll be paid the amount, but he will also be a member of the ECHS beneficiary, but will not be given medicines from the polyclinic. In terms of any referral, for that he can avail the services from the polyclinic. Now the FMA is verified at the time of collection of your cards, ECHS cards. This is done by the respective station headquarters based upon the PPO slip or your PPO. Based upon that, there is a reflection of the FMA. Now, if one is in receipt of the same, you are supposed to forfeit that. Thereafter only the card will be issued to you. For this, you will require a certificate to be issued by your bank manager to the effect that he states that the FMA is not being granted to the ECHS beneficiary. The last point, sir, there was a case in proposal wherein we had taken up a case for the medical health checkup, oblique the preventive test, something which is akin, which we have in the diagnostic center as a complete body checkup. This proposal is still in vogue, sir, and the central log is still pursuing the same. There are no orders yet on this, but we are hopeful that this should be passed. If once this is passed, then the ECHS beneficiaries will be able to take on the health checkup, will be able to avail the facility of a health checkup. May I have the next slide, sir, please? So having covered the updates, so there are certain requests and pleas from the regional centers, sir, which I thought I would just, in this forum, I should put up. Firstly, sir, is the patients, sir. At times, the ECHS beneficiaries are so emotionally connected with their claims, and we only request that please have patience. The claim will be passed. There is no denial of the amount. There may be a bit delay, but that also slowly we are trying to overcome. So we just only request for patience. Certainly the needful would be done. Second, sir, is the correct interpretation of instructions and guidelines. Now the guidelines, instructions are issued time to time. It is hosted on the ECHS website also. The necessary SOPs on the ECHS treatment is also hosted on the web page. But the interpretation is taken to one's convenience. In case there is a doubt on how to interpret those instructions, it is requested that the regional center or the polyclinic may be contacted. So we can then tell you what exactly it means and what are the connotations of the same. The government multi-specialty hospitals, sir. We have got the Umandurai, that is the Tamil Nadu multi-super specialty hospital, and the Rajiv Gandhi multi-specialty hospital, sir. These hospitals have got all the facilities, sir. But it is seen that many times the veterans are not availing the facility over here. The treatment in these hospitals are absolutely free. And in case it is also charged, you can have the reimbursement incomplete if at all any payment is made in these hospitals. We also urge all the veterans and the ECHS beneficiaries to please use your SMS, WhatsApp, or contact us on email, so there is no delay in communication, especially on a WhatsApp or a call, for any kind of mitigation, that is a quick mitigation of any kind of problem which you have. If you do not pick up the call, at least a WhatsApp message, and definitely we'll fall back to you with the necessary corrective action. Any issues if there's any advice required, we request that we please seek the advice of the regional center before committing in terms of uploading your claims or seeking of documents. We do not, it is best recommended that we do not have a fait accompli state, wherein the documents have gone or something has happened, and then thereafter the advice is being sought. So that actually leads to a lot of a delay. So we only request that the necessary advice may please be sought in time, so that we can just guide and also help you out in the mitigation of any kind of grievance which you have. Documentation, sir. Many a times the documents which are uploaded are always found deficit. That is the necessary checklist which are given. As per that, the X-rays, the images, the stents, the invoices are not uploaded. So we only urge that all kind of documents, whatever you have, please do submit it at the polyclinic. Let it be uploaded. So we do not want that the BPA gives the observation for lack of documents. So that again adds on to the processing time. So that is one which you would like to avoid. The second last is the prevention of frauds and unethical practices. So this is basically for the for few cases or instances which have come wherein some JCOs or NCOs have resorted to some unethical practices which have been highlighted by the empaneled hospitals. So maybe through this forum or through your interaction with them, it is requested that whatever the correct practices that may please be followed, that in letter and spirit, and any issues with the empaneled hospital may please be projected accordingly to the regional center. Lastly, sir, is the courteous behavior toward the staff of the empaneled hospital. Many times the empaneled hospital also complained to me saying that the behavior of the ECHS beneficiaries has not been courteous, and they have resorted to even to the extent of manhandling, sir. So that is one which we request that through this forum, sir, you may please disseminate to the in a forum to all the ECHS beneficiaries that the behavior courteous is what we would request from everyone, especially for the staff of the empaneled hospitals. So with that, I have finished. I will now request for your questions, and I'll be able to take them on.
Just 1 minute. I will. Yeah, I think sharing has been stopped. Okay.
Sir.
Right. I think now with the share screen being stopped, you can switch on your video and see whether we are losing your audio. Okay, so that there is a better interaction with the people. Okay, now.
Yeah.
Sir.
I'm Shanmugam.
Shanmugam sir, wait. Shanmugam sir, kindly wait. We have a lot of questions which we have received from people. I will have to put them up first. After that, when the floor is open, including I've got the questions from you. So kindly wait, sir. Okay, well, Sashikant, there are lots of questions which we have received from veterans from, I have received something from Gujarat. People have sent me from Tuticorin. People have sent me from Andhra Pradesh, so many places. Now, before I go on to the questions, I just want a certain, amongst the updates that you gave us, you mentioned about the emergency certificate EIR to be countersigned by the RC.
Yes, sir.
Come 1st March. Now,
yes, sir.
We have veterans outside Chennai. How would they get this particular certificate signed by the RC? Is it the responsibility of the hospital or individual?
Sir, there are two issues to it. Firstly is the empaneled hospital, sir. When the emergency has been done in the emergency hospital, sir, there is no issues because the emergency certificate is generated online. It reaches the polyclinic, and the polyclinic has to the OIC clinic has to acknowledge it, sir. So there is no issue on that. Hospital, it comes with the non-empaneled hospital. Now, in case there's an emergency, the first and foremost is that within 48 hours, please inform the OIC polyclinic. If once he is informed, he makes a note of the same, then the signing of the emergency certificate, when you submit, when the documents are being submitted, that the routing of it to the RC for signing of for signature of the director, that the OIC polyclinic, once you've done the intimation, there is no time. That can be done once the documents are submitted.
We lost you in between, so It's okay. I'll further take clarification and circulate it amongst the members later on. The next one on the update was you said the smart card collection from the polyclinics. But what we have been told is that we have collected in Chennai from the station headquarters. Is there a change in this?
So for Tambaram, Island Ground, and the polyclinic at military hospital. So these have to be collected for this. The other polyclinic, they collect these three, sir. That is at Kadalur, Tiruvannamalai, Vellore. So these are done at the respective polyclinics, sir. That is basically to avoid the travel of the ECHS beneficiaries, keeping in view the COVID protocols.
So basically, if you're part of the Island Grounds or the MH and the other one at Fort, sorry, which is the third one. Okay. So these
Tambaram,
people,
sir.
Tambaram. Okay. Got it. And now, see,
yes,
you have given us so many updates today, which generally the veterans will not be aware. One most important thing which you mentioned was that the individuals can go ahead and purchase their medicines for the next 2 months, but the bills have to be dated before the 28th of February. Now, how do this type of important information gets disseminated to the people? I mean, like if you share it with me, I could share it with our veterans and other veterans.
Already in, this is all. Yes, sir. In fact, many of the ECHS beneficiaries are already buying the medicine for the next 2 months. So now this I have just given in the update so that there is still time in case you do have the prescription, the medicines for March and April are yet to be bought. Then that can be done in the next 2 days. In fact, before 28th, and then you can claim the same, sir. So you stand to benefit from it, sir.
No, I agree. But then here there's a catch that the thing has to be dated before 28th Feb. And that's very important information.
Yes, sir.
I request veterans to kindly mute themselves. Ashok Kumar, kindly mute yourself. Yes, go ahead, Carl.
Sir, sir, as I said, sir, now the information that they should buy it for the next 2 this thing is through your forum. I'm giving that they can still buy it. The bills have to be dated before 28th. So that is the only requirement, sir. If not, the claim will get rejected. So that is the only issue, sir.
Fine. Now, coming on to the questions, which I've got lots and lots of them, but I think in your presentation, you have covered most of them, but still I would just read it out and then, the one is from Lieutenant Colonel R. Balaswamy, Plan of Action for COVID Vaccination for Veterans in Chennai. This has already been covered by you. Do you want to add something more to this?
No, sir. Only that, sir. I only request that just for a day or two, once the modalities are clear, sir, that will be promulgated as soon as possible as to how the ECHS beneficiary would avail this vaccination. Once the modalities are clear, that will be promulgated immediately, sir.
Fine. Then there's one from Lieutenant Colonel R. Ramkumar. His question is my dependent daughter, unmarried and unemployed, age 45 years, eligible to avail medical facility from ECHS?
Yes, sir. He is eligible, sir. Once he applies for his daughter, he can upload the relevant documents. And when he comes for the collection of the card, then there are certain documents which he will have to produce at the station headquarters or the polyclinic. That is, for example, the IT certificate, the age certificate, birth certificate. Certain documents are enlisted, sir. I will be able to, on a one-to-one basis, I will be able to give it to you. So he is eligible, sir. The daughter can avail the facility, sir.
Yeah, you can send it to me. I will pass it on to Colonel Rajkumar. Okay. Then the next question is from Brigadier S. Rajagopalan. Reimbursement for COVID tests done and medicines purchased from the market are pending for over 6 months. Now, you have answered this question in your presentation. But I have certain things which I have received from a few people. One is that but the claims, yes, the claims take months to be processed, and people feel that there is no proper feedback either from the Officer IC Polyclinic or from the regional center. The general reply given, it's under process. Oh, well, veterans do have a crib on this. So my question to you is, why can't the ECHS staff give sort of a more convincing reply? Because everybody is anxious to get the money that he has spent, the reimbursement. So instead of just generally saying under process, if what is the present situation or some updates could be given?
Okay. So generally, during the COVID times, there were issues of the processing of bills that I admit, sir. The third party administrator, that is the bill processing agency through which we get the bills processed, was close to approximately 3 to 4 months. So all the bills had got backlogged. There was a lot of a backlog, which now since from October onwards, they have started to process. So that was one delay can be attributed to the closing of the BPA, sir. Second is, sir, that many of these cases, sir, there were a lot of NMI. That is, now once an observation is raised, how quickly the ECHS beneficiary submits his documents to rectify the same. A very crucial role in the amount of time. Is, if at all any delay waiver is processed to the polyclinic, many times 1 month also adds on. So whenever the ECHS beneficiary says there is a lot of delay, there are these aspects which always come into play. That when firstly did he submit it? Was there any NMI which was generated? If at all observation was raised, how quickly was that mitigated? And as I said, sir, the BPA being closed for 4 months, so the number of claims had piled on. Now they're easily graduating on. So around 45 to 50 days was what they were taking. Up to 60 days is what they were taking to clear it. That is now reduced to almost around 30 days. So in the times to come, so this will further reduce to around 20 to 25 days.
Oh, that's great. That's great. But another thing, observation, one other point which I have is that observations on the claim are raised on piecemeal basis. That is, they raise an observation, that is sorted out, the claim sent back, again a new observation comes. This is all basically from the outsourced agency. And you did mention in your presentation that a proper checklist has been made. So let's hope we won't get to see this type of piecemeal things, observations coming. And this particular checklist, if it is also given to us, I will circulate it widely so that people are aware. But then you said it is available on the ECHS website, so I think this problem should be resolved. And
correction, sir. Just a correction, sir. The checklist has been promulgated to the polyclinics. The ECHS website, the checklist is given the SOP, sir. Now, this checklist, which I am mentioning, sir, is basically at the regional center level, compiling all the observations which have raised. We have tried to put in the maximum observations they have raised. So what all is required. So that a copy is what I'll be forwarding to you, sir. So that can be promulgated, sir.
I'll do that. And in one particular case, in this reimbursement thing, there was a case of treatment. And I believe the individual was asked to produce the approved rates of the Tamil Nadu state government. So my basic question is why this info is not available with the officer IC or with the RC. And even if the individual produces the rate, will that be taken as authentic?
So the COVID rates for Tamil Nadu government has already been promulgated. So that is in the month of June, sir. That is for 7,500 for non-critical cases and 9,000 rupees for critical cases. So there's a proper government order of Tamil Nadu which has been issued to the same. Now this was issued and promulgated by your observation that it was asked by by the BPA. So a copy of the same has been forwarded to the BPA that all claims pertaining to Tamil Nadu, if at all it comes, so that has to be referred to. This may be an aberration in only his case where it was asked for, but further onward, this has been sorted out. The need or the asking of this particular government order is not being asked now by the BPA, sir.
Fine, that's great. Now moving on to the next question. This is from ex-Sergeant Kantaya from Tirunelveli. It's a big question, so I'll just read it out. Of late, it has come to light that some banks are not stopped paying the FMA to members. On coming to know this, members requested the banks to stop paying the FMA. Some banks stopped immediately. Some banks advised the members to refund the FMA already paid in installment. but some banks like SBI are demanding the refund in one lump sum. The refund works out to 50 to 60,000 rupees. The members are not in a position to refund in lump sum. We understand that there were instructions from the central log ECHS that all RCs are to liaise with banks for stoppage of FMA via a letter dated 2nd July 2014. We feel that it was not followed. In view of the above facts, we request you to kindly weigh the case as an urgent one and avoid cancellations or confiscating ECHS card due to non-stoppage of FMA by the banks. Regional centers may liaise with the banks to stop paying FMA immediately and no recovery should be made. Now, this is an issue between the individual, the RC, and the bank. So, I'd like to know your thoughts on this.
So, yes, sir. So, firstly, the fixed medical allowance, sir. Whenever an ECHS beneficiary is applying for the card, it is very well indicated there that one should not be in receipt of the FMA. But notwithstanding, maybe because of an aberration or oversight, they generally avail the FMA as well as avail the services. Now, this was more prominent with the 32 kb system. But now on upgradation to 64 kb system to avoid oblique to ease out all these issues, the FMA, when you come for collection of the card, the PPO, it clearly states whether the individual is claiming his FMA or not. Now, if in case the FMA is being claimed by the individual, all the nationalized banks, the banks have been directed, and they are aware that in case any ECHS beneficiary comes, the bank manager, based upon the application of the ECHS beneficiary, issues a certificate to the effect that there is no FMA being claimed by the individual. That certificate he has to take and submit it at the station at card. Now, coming to the reimbursement of the amount in the FMA, individual was aware that he should not be claiming it, but he has claimed it. In case there's an issue that he cannot reimburse it in one lump sum, there is a provision wherein between the individual and the bank, it may be in piecemeal or in sort of installments that can be reimbursed back. But the amount has to be reimbursed back.
Okay, so moving on to the next question. Sure. This question I have is from Colonel R.S. Paramasivan. One member of ECHS has got his cataract operation done for his one eye from the empaneled Shankar Nethralaya. He prefers to get the cataract operation for the other eye also from the same Nethralaya. Whether his preference will be considered by the PC or it is compulsory to get the cataract operation done from ECHS Chennai only.
So once a ECHS beneficiary reports to the polyclinic, the protocol says that he will be checked by the medical officer of the polyclinic. If in case he feels any operation or anything has to be done, he refers him to the service hospital. And from the service hospital, once he's checked by the specialist, thereafter, if they're able to undertake, they can undertake the operation. Or if not, he's reverted back to the polyclinic to take a referral. Now, in this case of the ECHS beneficiary, if at all he's got a referral to Shankar Nethralaya, now there is no, it is not a compulsion that he has to get it at ECHS Chennai. If he has got the referral, a referral is issued for operation in empaneled facility. Now, whether the ECHS beneficiary wants to have the operation done at Shankar Nethralaya or Dr. Agarwal Eye Hospital, it is up to him. So the onus and the option for him to avail services from which empaneled hospital is totally with the ECHS beneficiaries. It is not mandatory to have it done at ECHS Chennai.
Oh, thank you. That was a very good clarification. The next question is from Major B. Karunanidhi. He says, old ECHS cards are not being accepted anymore in ECHS clinics. My wife's card has already reached station headquarters on 23rd Jan 21. She is hepatitis B patient. My parent clinic is ECHS Chennai. I request for early issue of card. I think you have answered.
So may I know the, so in this, you'll have to check out, so what is, which is the parent polyclinic of the ECHS beneficiary, sir? ECHS Chennai, sir. So the cards, I can only give an update, sir, that firstly, the cards, the issue of cards is not, the RC, it's not under the purview of the regional center. But as an update, sir, all the cards have already been submitted to the station headquarters. please bear with us. The OTPs will be generated at the earliest. Once it is generated, then the cards can be collected. If there's a specific, if there's a specific urgency, then maybe on a personal basis, I would try to get his card activated at the earliest.
Fine. I will request Major Karunanidhi to be in touch with you. Moving on to the next question. This is from Sergeant Sitaraman. He says, reimbursement of ambulance charges for my daughter. Claim submitted on 19th October 2019. Documents uploaded on 24th October 2019. I've sent reminder mails to ECHS Chennai, but no response. I mean, I would like a thing on this from your side, so that at least the individual is satisfied that somebody has looked into his query.
Right, sir. So in case no one has contacted him, my number can be forwarded to him. He can speak to me, sir. But otherwise, as per the SOP on the treatment management for the ECHS, ambulances charges are not reimbursable.
Not reimbursable.
Yes, sir.
But then why should the claim be accepted in the first go?
So that's what I said, sir. I would like to speak to the individual, sir, because there might be a aberration someplace wherein that the claim has been uploaded, but as of now, the SOP says that the ambulance charges will not be reimbursed. It is not done. Likewise, ECHS also, we follow the same norms. The ambulance charges will not be reimbursed.
Okay, right. Now, the next question, there are about 5-6 questions. These are all received from ex-Corporal Suresh Babu. So the first one is about non-availability of a lady doctor in ECHS Island Grounds Polyclinic. So will you first take that, then I'll come to the next question.
Sir, now, so the employment of doctors is based upon the vacancy created or the terminal or the termination of the contractual employment of the doctors, sir. Now, that depends upon the applicants. Now, as a special request, I can approach the station headquarters for maybe a transfer of a lady doctor, but that will have to be checked by the station headquarters before they execute the same. So I can only put in a word, sir. Now, why a lady doctor is required? There are many issues to be seen, sir. What is the footfall, the number of female patients, ECHS beneficiaries coming there? Many things to be looked into, sir.
Okay.
So this I will revert back to you, sir. This may be in the point given by the individual, maybe a one-off case, but such a lady doctor, I'll really have to look into it. So I'll revert back to you on this one.
Right, thanks. The next question he has about is the empaneled hospitals and why no. I think that you've answered in your presentation. The next query he has got is direct referral from ECHS polyclinics instead of referring to MH, as there is specialist doctors care in MH Chennai, due to which ECHS members are experiencing a lot of difficulties. His basic question is why not route a referral directly to the hospitals instead of routing it through MH?
Sir, we are giving the referrals directly to the empaneled hospital, sir. We are only giving it to the MH in cases where we feel that the referrals are being given directly for the empaneled facility, wherein the ECHS beneficiary can go to whichever empaneled facility of his choice. So this, I think there is some issue in this, sir. We are giving.
Okay, fine, no issues. Then he's got a question on the dental hospital and a few other things. I will not dwell on them because you have already covered in the presentation. That would just amount to a repetition. And yeah, now I have a very interesting question. This is from ex-Sergeant Venkat. He says, my polyclinic is at MH Chennai. I'm diabetic. I'm having the latest 64 kb card. One day, unfortunately, I have forgotten the card and visited the polyclinic. They are unable to provide me medicines. Earlier, with my service number, they could generate doctor appointment. Now, they told it is not possible. Sometimes in emergency, we may visit. Please help to resolve the issue. Authorities told me they can help with the old card, but not with the new card. I have been having a soft copy in my mobile. I am attaching for your reference. Now, basically, I think these are the inherent checks that you have got in your new 64 KB card. But is there any facility or anything, a concession given if, let's say, a veteran is coming from a far off place to his polyclinic and by chance he's forgotten his, ECHS card? Some sort of a consideration be given for such people and help them out?
Sir, technically, if you see, sir, it is not possible because the 64 KB card requires that the veteran has to swipe his card on the online system. Thereafter, only the issue of medicines through the pharmacy or the consultation by the doctor is possible. Now, this is a very unique case which you have said, sir. There may be a via media wherein the medicines can be given, but a mental note, a note of the same will not, means there will be no official entry of the same. The medical doctor can consult, can give the consultation, medicines can be given, but this is totally off the record. But with the premise that he will have to again visit the polyclinic with again his card, so the same can be regularized. So in this will resort only if there's an emergency per se.
Right. Then the next question was from Wing Commander Shankar. He is asked about the re-empanelment of Neos Hospital. This you have already covered. And yeah, the next question I have is from ex-Junior Warrant Officer Edmund V. Ryan. He is basically from a place near Tuticorin. He says, I'm a veteran of the 62, 65, and 71 wards. Now patient of heart, diabetic, thyroid, arthritis, wife partially paralytic left leg, and patient of heart, diabetes, BP, thyroid, etc. She can neither travel by bus nor walk properly. We are living alone in a village about 45 to 50 kilometers away from our Tuticorin polyclinic. My humble submission for your consideration. Polyclinic that suffer from adequate staff strength, offer funds for local purchase, need to be given more attention by the RC. Aged, disabled patients with major diseases living in villages far away from the polyclinic may be authorized to purchase of medicines from the nearby pharmacy for reimbursement by the parent polyclinic. And annual medical checkup stroke review of patients with major disease may help the patient and polyclinics to administer due care of patients with major ailments. So his basic thing is that where the polyclinics do not have the adequate strength or the adequate funds, he wants more attention to be given to them. Then his question is, people are living far away from the polyclinics, if they can be permitted to local purchase the medicines and get the medical reimbursement. And the last point is a suggestion for an annual checkup or medical review for older patients.
Right, sir. So firstly, coming to the local reimbursement, sir. So for the last 6 months till 28th of Feb, though, as I said, sir, the medicines can be purchased. Now, in case there's a scenario wherein the extension of the so-called provision is not given. So in that case, sir, the medicines from the SCMO, that is from the military hospital, or from the NS certificate will be required. Based upon that, the medicines, firstly, if it's not available, the OIC polyclinic can buy it from the authorized local chemist. That is one. If he wants to buy it from outside, that is not using the services of the pharmacy of the polyclinic, then a NS certificate given by the polyclinic, based upon that, he can buy it. But this only, it can only come into effect after 1st of March if there is no extension on the present policy of individual reimbursement for medicines. Now, coming for those who have got a problem wherein they cannot visit the polyclinic, sir, there is a domiciliary assistance, a provision of a domiciliary assistance which is given in the treatment management SOPs, wherein once the OIC polyclinic is informed of the patient's condition, the medical doctor can visit the residents of the so-called ECHS beneficiaries to give the consultation and issue of the medicines. Coming to the medical checkup, so as I said, the medical checkup per se, the orders are, it is not not in vogue, sir. The proposal has gone, but still we are waiting. We are just hopeful that the same might pass. So medical checkup per se is not permissible. Lastly, sir, the budgetary support, sir. Now, budgetary support in terms of reimbursement, I said the budgetary support is healthy. Now, apart from that, each of the OIC polyclinic is given support, is given a monetary power, financial power of 1.5 to 2 lakhs, wherein he can buy the medicines. So using that also the medicines can be purchased. Now, but again, sir, Tuticorin PC that falls under RC Coimbatore. So there the OIC can always be approached for the domiciliary assistance as you asked, and thereafter the provision exists, so the medical officer can pay a visit if the patient or the ECHS beneficiary is terminally or seriously ill and is in a state of immobility.
Wow, right. Sorry, I was not aware that Tuticorin falls under Coimbatore. I thought every polyclinic in Tamil Nadu comes under you, so that was my ignorance. Okay, the last question I have is from ex-Sergeant Bharadwaj. He says ECHS is not issuing pen for insulin at present. It is suggested that the same may be issued. Though it's only a one-time investment, it costs around 1,600 rupees. Request you to consider for the benefit of all personnel who are prescribed with insulin, which can be administered with pen only. His parent polyclinic is Tambram.
Sir, I've already got this point, sir. So I've taken up a case. I will definitely revert back to you on the latest. It would be incorrect for me to comment on its present status, but I will definitely come back. We have taken up a case as to how this can be mitigated. Sir.
Fine. Wonderful. Well, ladies and gentlemen, I've finished with the questions which people have sent me through mail, WhatsApp, SMS, phone calls, etc.
Am I audible, sir?
Yeah, you're audible. You're audible. You're audible. Okay. So, in case any of our veterans who are attending the show want to ask any questions, you are welcome to unmute yourself and ask the question.
Yeah, thank you, Harsh. This is Kan Shanmugam and Sashikant. I think you are given us a very good picture of what is the current situation in ECHS. I had 4 points, and out of the 2, you already answered to me in the WhatsApp. One is the list of empanel hospitals in Chennai. Second, vaccination for COVID. That both have been clarified. I'm still left with 2 points. One is increasing the multi-speciality hospital. The establishment is mostly in concentrated, as per my knowledge, in Chennai, Vellore, and Coimbatore. Now, Vellore got a CMC hospital and n number of hospitals. Coimbatore also has got a n number of hospitals. It's the Mecca Madina, Tamil Nadu. Now, there are 2 ways. Your predecessor Sandeep, Colonel Sandeep, we had done some groundwork. Now, what happens is the cannot match with the corporate rates or the insurance claims by the private companies. You cannot match. So the multi-speciality hospitals prefer cards from corporates, cards from insurance. They don't entertain CGHS or ECHS mainly on the rates. There was one suggestion given by at least 3 of the hospitals on behalf of ECHS. I had a very renowned surgeon who is known to me from my hometown, Coimbatore, and MGM and ENT hospital run by Dr. Mohan Kameshwaran, who is a personal friend of mine. What they say is, Colonel, we understand. We also want to serve with the ECHS community. At least give us, if not the corporate rates or the other rates, at least give us the All India Institute of Medical Sciences rates. Now, I won't know what is the rate for fixed by All India Institute of Medical Sciences, which your headquarter, ECHS headquarter only can find out. There are a number of multi-speciality hospitals willing to take on the ECHS load, provided they get the All India Institute of Medical Sciences rate. Now, this is a little long-drawn process. I had a couple of friends in the medical colleges and things like that. What they have suggested is, multi-speciality hospitals, they will be reluctant to take ECHS load because they know the claim takes time and there will be observations, counter-observations, things like that. However, they have given me one clue, which I wanted you to tell you so that you can exploit it. There are a lot of medical college hospitals, like for example, SRM, Ramachandra, Savita, the dental college, medical college, university. These are all medical colleges which has got the same facility as a multi-specialty hospital, rather a better facility. Now, these hospitals, if you can approach, they will accommodate because they are not for money. They wanted patients for their, I'm being very frank, for the students to learn. Of course, the operations, surgeries will be done by qualified surgeons, not by novices. That part I clarified with these hospitals. So the medical colleges hospitals is one source for you to start with, which on behalf of that I'm willing to come with you. Let's visit. So we went to this SRM. SRM said, "You please send us the format and all." And after that, I don't know what happened. Similarly, GEM also was willing to accept ECHS patients, but then I don't know what progress made because then his posting came. So there is a gap. So why I have given you this background is now you have come, we have seen you, and you have been very cooperative and really concerned with the ECHS community and the veterans community. So I request you to take up cases of empaneling medical college hospitals with us. That is one. Point number two is after the elections, Radhakrishnan, who is a health secretary, is a very pro defense person. He is very, very, very sympathetic to ex-servicemen. Now, through him, we should somehow get some, government GO to certain amount of percentage for ECHS multi-specialty, because every year they go for renewal. Like you must be renewing this empanel hospital every 2 years. The multi-specialty hospitals also go for renewal every year to the health department. So we must explore that possibility. But this is the right person to do is the GOC, because he can always put in a word to Chief Secretary and Health Secretary in his own cloud. That will work out. So these are my two suggestions. And the fourth point which I wanted to raise was, the state government that is through the thing. So these are my points.
Right.
Thank you.
So I'll just tell it, sir. Now, sir, for the empanelment, sir. So the methodology as to how I have gone, sir, for the empanelment, there is an issue. There are issues in Chennai and the north districts of Tamil Nadu, sir. Firstly, sir, all those hospitals which are empaneled with CGHS and not with ECHS, I have approached them for the empanelment. Now, because of the COVID, there was an issue that, same as I said, sir, the doctors were not available. So they have said that they wanted some time, sir. So I'm just waiting for maybe some time more till the time let's say till by March, wherein they said these services will get regulated. So thereafter, then I will approach the hospitals which are empaneled with the CGHS. Okay. Now, secondly, sir, for any hospital to get empaneled, there are certain criteria, sir. Firstly is the NABH criteria, sir. There is a national accreditation board for hospitals and labs, which is in Delhi, sir. Now, there are 3 levels to it, sir. An entry level, a progressive level, and a final level. Now, the total number of NABH fully accredited hospitals in entire Tamil Nadu is only 54. And for Chennai, there are only 24, sir. I have spoken, the medical college, as you said, sir, SRM and Savita Medical College, I have spoken to their management. These are all entry-level NABH certified hospitals. So that is why they are not eligible for the empanelment. As GEM and Ramachandra, I have spoken to them. So they also, I am yet to, I will approach their management once again, sir, for the empanelment, because all the hospitals during the COVID time had asked for certain times because of the doctors not being available. So Ramachandra, yes, I do have it on my radar, sir, that it is to be approached for empanelment, and the GEM hospital, sir. So once that is done, then accordingly, I'm hopeful, sir, that the empanelment process should take place, sir. But many times, sir, most of the branded hospitals, like say Fortis, Malar, or be it Apollo, as you rightly said, the CGHS rates are very less. And for them, the major reason they attribute is that it is economically not sustainable for them to go as per these rates. Fortis Malhar, sir, it's a branded hospital, and you wouldn't believe, sir, as on date, it is only an NABH entry-level hospital. I was under the impression that it's fully accredited. So the NABH, what accreditation, that is now never revealed by the hospital unless asked for, sir. So the first criteria is that, sir. So we are into it, sir. The GOC certainly, sir, I'll put in this point for his, during his, whenever he schedules his visit for the health secretary, sir, to put in, give a push for the ECHS empanelment. That certainly I will do it, sir.
Thank you very much.
Sir, that's about it, sir.
And as far as GEM is concerned, whenever you are going for discussion with them, I'm willing to volunteer to come with you because I know the HOD and MD personally.
Definitely, sir. I've noted this point, so I'll certainly contact you, sir.
Thank you.
Thank you, sir.
Thank you, sir.
Sashikant, the next question for you is from Major General Govindaswamy.
Yeah.
Sir.
My point is like this. I've applied for the 64 KB new smart card way back on December 22nd. But there's no hope. I do not know where it stands now because already we are coming into March. Is there any way in which you can check it? I mean, I'm sorry, I couldn't give you official, but I've got nothing else except to say that on 22nd, I've paid off that amount and it is there. That's all. That one.
Sir, you paid for it on the 22nd of December 2020, sir? Hello, sir.
Yeah.
Govindaswamy, sir, did you pay for the card on the 22nd of December?
Yes,
That's what he's asking.
22nd of December 2020.
Okay. Sir, if I can have your contact number, on Monday, I will be able to revert back to you on just on the status. As I presume, sir, it would take some time because generally the verification by the records and thereafter the printing of the card generally does take time. I will just check from my system. If at all the card has been printed, that update I will be able to tell you on Monday, sir. I'll just request for your contact number, sir, please.
I will share it with you.
Sir.
Govindaswamy, sir, I want to ask you one thing. I wanted to inform you one thing that, if you have, it's better to download the ECHS app on your mobile and, the status of your card is known immediately, even if there is an observation. You will not believe I applied for the card on the 9th of February. The same day, after 2 hours, I received an observation. I cleared it. On every day, I've been getting updates. In 10 days' time, on the 19th, my status was, your card is printed and ready for dispatch. So I think downloading the app will give you live information, sir. He's not there? Right, got it. Okay, Sashikant, Mrs. Mohandas has got a question for you.
No question. I just wanted to thank Colonel Thuma. He has enlightened us on so many issues of ECHS. Thank you so much for your valuable time. And we are all awaiting more news on the vaccination. So the moment it is, you hear something about it, we'll be very happy to hear something more.
Definitely, ma'am. The moment anything comes on that, the first thing I will definitely immediate on a priority basis to all the ECHS beneficiaries, sir.
Thank you so much. Thank you so much, and God bless you.
Thank you, ma'am.
Colonel Jairaj, you have a question, sir? Yes, Jairaj has got a question.
Yeah, I already interacted with Colonel Sashikant about this. There was a problem about a JCO, retired JCO from Viluppuram. He had taken a referral in his polyclinic. The referral was for 1 month, and there were 3 sessions allotted to him, written in the referral. And the referral was to Global Hospital. So he came to Global Hospital, he got treated. When he went again for the second session, they said, no, we will not permit this because our bills get pended. So you have to get a fresh referral. So this point I raised with Colonel Sashikant also. He said he will check up on this and come back. And he also mentioned that people from Viluppuram, Kadalur and other outstations, they can straight away come to ECHS Chennai Polyclinic and get a referral and go to the Empanel Hospital. There is, in case they are staying in Chennai and their parent polyclinic is outside. So I need some clarification on this.
Yes, sir. Sir, the case you're referring to, sir, that is to in case of Subhadar Jayakumar, sir.
Yeah, he got the referral from ECHS Chennai.
Yes,
but,
sir.
This problem has to be sorted out.
So, as I said, sir, it is the interpretation of the hospitals wherein there was something amiss. Now, the referral says a validity of 30 days and 3 sessions admissible. Now, what the hospitals are resorting to is basically a shortcut, I would say, because the volume of patients they see in a day is humongous. They do not wait or do not want to pend any claim for more than 15 to 20 days. So that is why they, at their own level, have been telling the ECHS beneficiaries to come with a new issue of the referral. Now, this case I have taken with the bill processing agency. Now, there is a via media wherein for one referral, multiple claim IDs can be generated session-wise. Now, the empaneled hospitals were not aware. So I have asked for the complete flow chart as to how this is to be implemented. Once I get this, the major hospitals like Global, Shankar Nethralaya, they will get it implemented. So in the what I see, sir, in future, sir, this will get implemented wherein validity of 30 days will be implemented. It will be executed and it will be honored by the hospital, sir.
Thank you.
Thank you, sir.
But the other point you
has got a
mentioned.
question for you, sir. Brigadier V.S. Subramaniam has got a question.
Thank you.
Sir, kindly ask your question, sir.
Colonel Thuma, this is regarding the referral to MH. Being over 70 years, one can go directly to the MH specialist without taking a referral from the ECHS. Now, when the specialist prescribes medicines, the MH dispensary does not give any medicines. We have to come back to the polyclinic, get the doctor there to prescribe those same medicines and then collect it. Now, person like me who is dependent polyclinic is island grounds. There's no point in my going all the way, cutting time because I'm a senior citizen, get the prescription, but come back all the way to island grounds to the polyclinic to give in the medicines. I think something should be done. The MH should be able to give the medicines to these people. That is the point I have. Second point, the card. I applied for the 64-bit card in 2018. My card came in, I think, July, August 2020. But my wife's card is still not come.
Sir, did you check it on the app, sir? The present status?
App, not conversant with the app. That's why I haven't done that. Anyway, I will, now that Harsha has mentioned it, I'll try and do that.
Right, sir, and I got it, sir. So, firstly, the MH referral, sir. Now, sir, with the 64 KB card system which has come, the collection of medicines you can collect, if you've gone to the MH, you can collect the medicines from the pharmacy of the MH polyclinic also. Just a verbal communication from the OIC OIC Island Ground to the OIC Chennai, and from their pharmacy they will issue it. So you don't have to go all the way down. Because the system is online, the moment you swipe your card on the reception, it is entered in the database. So thereafter, whether it is Island Ground or Chennai, the only verbal communication or a verbal acknowledgement by the polyclinic will suffice, sir. You don't have to go all the way back to Island Ground.
There is, I think, slight, I think it's a personal problem, I think. Because I think Kamanal probably has ruled this. Therefore, the dispensary says, if out of this, we won't give you. So there is no point that one can...
Actually, sir, actually, as part of the budgetary allotment, sir, the ECHS polyclinics for the purchase of the medicines, there's a separate budget allotment which is given by the MH commandant. So any ex-serviceman per se who comes to the MH, he does not give them medicines from his pharmacy. Invariably, he tells them that they should go to their dependent polyclinic to take the medicines.
Correct.
Now, in your case, since your dependent polyclinic is Island Ground, to save you the trouble of traveling all the way back from MH to Island Ground, you can report to Polyclinic MH, which is there, sir. The OIC of Island Ground can just give a verbal intimation to the OIC of Polyclinic at Chennai, and he will give you the medicines from his pharmacy. You just have to swipe the card or just carry your card along, sir. So you don't have to travel all the way back, sir.
Sorry, what you say is absolutely right, but that doesn't happen in fact. I had to go back to the MH polyclinic. The OIC was very condescending. He said, we'll have to give a prescription. He made me wait, had to go to another doctor, he gave me the prescription. Then he said, we will give it to you, but please don't do this in future. We are unnecessarily coming, saying, please get yourself attached here. Otherwise, I have to do you a favor giving you this medicine. I mean, I don't think that is the way to treat a person like me. That's a different point. But anybody, I'm past 80, and now to hear all this from people like this, that's, not good.
I understand. But sir, you had visited the MH for what? To visit the specialist, sir?
Yeah, eye specialist.
So, sir, wouldn't it be prudent that you take the referral to one of the empaneled hospitals, sir, Shankar Netralaya or this thing better rather than going to the MH, sir?
No. I had got, initially I went to the MH when they were not performing the operation. I got a cataract.
Okay. Sir. Right, you're absolutely right, sir. During the sir.
For that,
sir,
I had to go to
sir. Sir, actually, sir, during the COVID times, sir, all non-emergency operations, including cataract and say dental, all that was stopped. Now that has resumed, sir. I think maybe your grievance must be of that particular time period, sir.
No, I had already got the operation done. It is the operation I had a little problem. Anyway, I thought the MH doctor was quite competent to resolve the issue. I went. She was very sweet. She resolved the issue. But the medicine became problematic.
Right, sir.
That's all.
And sir, regarding ma'am's 64 KB card, sir, if you can just drop me a message, sir, with your service number or the registration number, I will just look into it, sir.
I'll do that. Thank you.
Sir.
Sashikant, Colonel Krishnaswamy has got a question for you. Krishnaswamy, sir, ask your question.
Yeah. Can you hear me?
Yes, I can, sir.
Shashi, I am extremely grateful to you for the lovely talk that you have given. Firstly, I would like to tell you that you have said patience. That is a very nice word that you used in the first point. I have a lot of patience because you have done a lot of things for me, and I am alive and laughing and kicking today because of the medical treatment that I have received. But I wish to share with you that the reimbursement of the claims is done rather drastically cut. I can afford it, so I won't make a claim. But there are people who brought in other rank, brought a claim for almost about 8 lakhs, and he was finally sanctioned almost about 2 lakhs. No, I mean, a similar case to me also, but I'm not going to raise a point. But don't you think there should be a little sympathetic way of treating? I mean, for other rank to bear the 6 lakhs is going to be a hell of a problem.
Sir, so for this, sir, like firstly, sir, all the rates, which is now, sir, all claims which come, there is a 2-level scrutiny which happens. Sir, one is at the BPA and second at the RC. Now, anything which gets left out at the BPA gets scrutinized at the by the medical officer here in the regional center. Now, all the reimbursement claims are strictly as per the approved rates of the CGHS 2014, sir. So whatever is entitled as per that, and if it's a package procedure, that is admissible. Now, in cases wherein I do have cases, sir, wherein, like as you said, 8 lakhs spent, but the amount which is approved was 2 lakhs. So in that case, sir, if you refer to my presentation, sir, I said that if in such cases wherein a ECHS beneficiary feels very strongly that he deserved more than the entitlement, he can go through the HPC, sir, the High Part Committee. And rest assured, sir, in my recommendations, I do give a very strong recommendation. And it is up to the High Part Committee to take a decision whether to sanction extra in addition to the approved rates, sir.
Thank you, and I'll have a chat with you.
Roger, sir.
Well, Colonel Srishikant, I think we are done with the questions. And
right, sir.
Now you can switch on your video so that we could see you for one more time. And yes, thanks for a wonderful talk. I mean, it's again what I would say is
my pleasure.
A lot of things which we were not aware. Okay, and my request to you is that any update that you want me to percolate down to the veterans, be it officers or the other ranks, okay, because there are many veterans groups. So whatever updates, if you can pass it on, it will go down the line to maximum number of people, at least through WhatsApp. Okay,
I'll do that, sir.
And thanks once again for all the time that you have given to us. Sir. And I will now request Marshal Vartman to say a few words and conclude.
Thank you, sir.
Talk show.
I had a very long session. And Colonel Shashikant, you patiently answered each and every question, I must say, and also your positive attitude. I mean that's really a good feeling that we veterans get. Your positive attitude to find a solution to everything.
Sure.
Thank you very much for that. And
Sir.
we are, let's say, less stressed at the moment, and we'll keep in touch with you. We look forward to, in the next 2 days, to know about the vaccination, because I think that is the prime thing on all our minds. And if it can be done by the polyclinics, nothing like it,
Yeah.
all of us can probably in a couple of days, have our vaccinations done. But I'm sure there is a method in everything which goes on, and it will work. The other good point, which is a takeaway which you gave, which all of us must know, is that the MH cannot refuse. I think the first thing is report to the MH if there is a urgency. Am I right? I understand that same. They cannot refuse treatment. This is something which must be, passed around to all veterans. In crisis and you don't know where to go, just head to the MH first. And at least when we are close to the MH in Chennai, at least, it is very helpful. So thank you, Shashikant, and our very, very best wishes to you. Anything we can do to support, we are always available to you. Thank you very much. Thank you, ladies and gentlemen.
Thank you very much for the.
Thank you.
Thank you very much for the time, sir. And I regret the technical glitch, sir, which was quite a spoil sport. Thank you very much, sir.
No problems at all. Thank you.
Thank you, Shashikant. Thank you very much.
Sir. Thank you very much, sir. Take care, sir.
Good night.
Sir. Thank you, sir.
Good night.
Bye, sir.
Good night, ladies and gentlemen. Good night.
Good night, sir.
Sir. Good night, sir.
Good night. Good night. Good night.